Good morning, everybody. Welcome to day 2 of our conference. I hope that you're having a great time here in Philadelphia, and I hope you didn't get wet last night in the rain. Actually, we've been here, the APSE team, since Saturday, and we haven't really left the hotel. So my mother actually texted me from Buffalo last night and said, "We're watching the news. Is everything okay?" And I said, "What are you talking about?" And I didn't even know there were thunderstorms, so I hope that you guys didn't get caught in them. Just wanted to give a special thank you to Vic Gable and Suzanne Irby. If you came to the reception last night, they were dressed up as Ben Franklin and Betsy Ross. That is like above and beyond the Call of Duty. Thank you. We have a great day planned today. We have some great speakers this morning, and I just want to go over a couple of housekeeping things before we get to the program. Please remember that the awards luncheon is at 12 noon today in this room. We have great awards. It's going to be a great program. Wally Talbot is hosting, so, beware. Wednesday evening activities are posted at registration. There's a lot of really great things that the local host committee have put together for you. Member breakfast tomorrow opens at 7:30. The food station opens at 7:30. We will begin promptly at 8. And we have a great speaker, Maria Town, who is the White House's Office of Public Engagement Disability Liaison. She's fabulous, and she'll be also in this room. Let's see. The last day of exhibiting is today. Please check out our exhibitors downstairs on the mezzanine level. And finally, we have our APSE t-shirts for sale at the front desk, so please buy them, and we will have them available on the website as well. So yesterday we talked a lot about what happens in Washington, and it is always an interesting experience in Washington, and you probably reading it from the outside, a lot of people say, "Ugh, how do you work there?" But here's the thing. Get to work with really awesome people, and both of our speakers today are people that I get to work with all the time and who are working so hard to move the needle towards where we want to go in terms of our agenda. So I'm so happy to have them both here today. We have Sharon Lewis from the office. Sorry, Sharon has so many titles that I have to She's Principal Deputy Administrator for the Administration for Community Living and Senior Advisor to Secretary Burwell on Disability Policy at Health and Human Services. And our first speaker, you probably know, he really doesn't need any introduction, Ari Naiman, who is the president of the Autistic Self-Advocacy Network. Ari co-founded and runs the Autistic Self-Advocacy Network, an organization run by and for autistic adults, seeking to increase the representation of autistic people across society. In 2009, President Obama nominated Ari to the National Council on Disability, a federal agency charged with advising Congress and the President on disability policy. He was confirmed by the Senate in July 2010 and currently chairs the Council's Entitlements Committee. Ari is another one. He has so many awards and appointments. Ari served as the vice chair of the New Jersey Adults with Autism Task Force, and he is actually now on the WIOA Advisory Committee for increasing competitive integrated employment. So please welcome Ari to APSE today.
Thank you so much for having me here today. It's a pleasure to be here with so many people who have dedicated their careers, their lives, and their personal causes to advancing full inclusion and equality of opportunity for people with disabilities. I want to begin somewhat counterintuitively by going back about 98 years or so to 1917. How many of you have heard of a film called The Black Stork? Not very many of you. Later re-released under the title, Are You Fit to Marry? The Black Stork was a piece of propaganda for the American eugenics movement. It opens on the scene of a handsome doctor walking across a window from which we can see inside a young man with a clear physical disability, and he's presented as very sickly and pathetic. And the doctor says to the camera, "This young man isn't up to par, but it's not really his fault. It's his parents." And we suddenly flash back to the scene of the young man's birth, whereby the mother has just given birth to a child with a disability, and two doctors are counseling her. One is counseling her to allow him to operate to save the child's life. And this doctor is presented as the most arrogant individual possible. "Let me operate to save your child, and your child will be a testament to me and how good a doctor I am." And the other, the titular hero of this piece, Dr. Harry J. Hazelton, is saying, well, in fact, the best thing to do is to let the child die. And the mother, perhaps out of some kind of natural instinct common to all mothers, is inclined first to go with the first doctor, save her child's life, when all of a sudden the black stork has her treated to a sudden vision of the future for her child. He grows up and he's presented again as very sickly and pathetic, and he has trouble finding anything but menial work. Uncle Sam will take him. This is presented by the movie as the ultimate sign of his worthlessness as a human being. And then all of a sudden he decides, I've had enough of it. He goes, he buys a gun, tracks down the doctor that operated to save his life, and shouts out, "Why did you suffer me to live?" and shoots him. Whereupon we're suddenly taken back to the operating room, and the mother decides, of course, she should go with Dr. Hazelton's advice and let her child die. And the film ends with a brief editorial in favor of national eugenics laws. This particularly dark piece of American history I find instructive because when we talk about advancing the rights of people with disabilities, and when we talk about moving away from congregate and institutional models, whether in the context of residential services, day services, or even employment services, we have to understand where we're coming from. We have to understand the hole that we're trying to dig ourselves out of. The realization that at the end of the day, throughout most of American history, disability and the infrastructure designed to support people with disabilities were not about empowerment, were not even about impairment, but were first and foremost a social category. In the same year as the Black Stork came out, the head of the Missouri Medical Association, in his presidential address, commented that we need a policy of mass institutionalization for the feeble-minded. Such a policy, the president pointed out, would greatly reduce our criminal class, would reduce the number of prostitutes by 70%, and would relieve us of the unsocial acts of the hobos, the IWWs, and others of their ilk. For those of you who aren't aware, the IWWs were a labor union. Institutionalization and the segregation of people with disabilities in this country emerged not out of a desire to protect people with disabilities, not even out of any heavy-handed or ill-advised assessment of levels of impairment of the people involved. Institutionalization and the resulting segregation that led to segregated sheltered workshops, day programs, many, many other things as we tried to dig ourselves out of that hole but found ourselves stuck in that same old model, comes from looking at people with disabilities as a social category that is defined by not being good enough to be a real human being. And so now when we come forward those 90 some odd years into the 21st century, and we deal with trying to do the right thing within a service system that is still digging itself out of the history of the eugenics movement, that is still moving away from a conception of disability, a view of disability that is defined by lack of respect for the personhood of people with disabilities. We have to start by looking at what we can do to undo some of that damage. And in that sense, employment is one of the most important areas we can focus on in our disability service provision system. American society has always focused heavily on employment as a pathway to social advancement, as a pathway to recognition of equality of opportunity. We talk about taxpayers as the fundamental unit of stakeholders in our society. It's not so much that this is necessarily a good value. We want to recognize, and certainly in the disability advocacy movement, that everybody is a stakeholder, that everyone is a person. But in American culture, seeing yourself represented in the workforce is the first step to seeing yourself represented and recognized in the broader society. And because of that, in the last 5 years in particular, we have seen tremendous progress and tremendous emphasis and investment focused on advancing employment outcomes for people with disabilities, precisely because we know that if we can succeed on employment, we are going to have a powerful tool in our hands to succeed in every other aspect of disability policy: healthcare, residential services, day services, dental, et cetera, et cetera. If people in the broader society can conceive of people with severe disabilities as part of the workforce, as their co-workers, then they will be able to conceive of people with disabilities as their equals in any number of other places in this world. You are the tip of the spear for the disability rights movement. And in the last 5 years, the federal government has created a number of unique and essential tools to empower the transition away from sheltered workshops, away from segregated day centers, and towards integrated employment. Most of these tools are rooted in one way, shape, or form in the Medicaid program. Let me ask you all a question. How many of you here are Medicaid providers? Quick show of hands. Okay, so I'm seeing about half the room. Do you see yourselves as healthcare providers or employment services providers? Raise your hand for employment services. Raise your hand for healthcare. Regrettably, the agencies that are bringing dollars to the table in employment services, state Medicaid agencies, are by and large not aware of the fact that they are a major provider of employment services. Regrettably, the people who are bringing primary financing for the bulk of employment services to people with intellectual and developmental disabilities, and a lot of the populations that most benefit from supported employment services tend to look at their job as primarily the provision of medical services. Most state Medicaid directors would be shocked to learn that Medicaid is in the employment services business to begin with. And the history of how that happened was largely looking at employment as a service that could help improve health outcomes. And so it's only been relatively recently that we've started to see any kind of leadership at the federal level or any kind of leadership from state Medicaid agencies in focusing on employment outcomes. Many of you are aware that in September of 2011, the federal government issued a landmark document, the September 2011 Informational Bulletin on Employment Services from the Center for Medicare and Medicaid Services. Did a couple of things. First, it articulated some of what we already know. It separated out supported employment into two definitions: group supported employment and individual supported employment, recognizing that there's a very big difference between an outcome of someone truly being supported in an integrated way in their own job, in the general workforce, where they're paid by their employer and included just like any other employee, and some of the mobile work crew and group-supported employment options that we've seen in the past and still do see. CMS clearly articulated that group-supported employment should be focused on eventually transitioning to individual supported employment. They did a couple of other things. They added a career planning service definition. They really articulated a broader agenda around employment services for state Medicaid agencies. But the most important thing that CMS did in September of 2011, and really one of the things, along with the work of the Justice Department and a wide variety of other stakeholders at the federal level, that really helped to jumpstart the shift towards integrated employment of the last 5 years, was it said that pre-vocational services, the main Medicaid financing stream flowing to sheltered workshops, should be looked at as time-limited in nature and not an end unto itself. Now this should not be a highly shocking concept. Pre-vocational services, preparing somebody for employment, is not a process that should last for 20, 30, 40, 50 years. At a certain point, with that much preparation, you should actually be moving into the integrated workforce. But of course, we know that that's not something that happens with sheltered workshops. That's not a process that actually occurs. The Government Accountability Office has found that only about 5% of people with disabilities in sheltered workshops ever move on to integrated employment settings. And we know from the great work of a wide variety of different researchers that people with disabilities who go straight to supported employment rather than that detour into the sheltered workshop have higher wages, lower service costs, and better outcomes. If sheltered workshops are supposed to be preparation for integrated employment, they are doing a very poor job. And of course, we know that. But unfortunately, in the past, the sheltered workshop industry has been able to sell themselves as a means of preparation and maintain those long periods of time of 10, 20, 30, 40 years in which someone is preparing for a real job someday in the far distant future. And with the CMS's September 2011 informational bulletin, states were put on notice that this is not going to fly anymore, and they need to revise their core service definitions to really make some of those underlying changes. Now, around the same time this was going on, another rather interesting federal policy development occurred. CMS issued an advance notice of proposed rulemaking in 2009. An advance notice of proposed rulemaking, for those of you who don't know, is when the federal government says, we don't have a rule yet, but we're thinking about maybe someday, in the fullness of time, potentially creating a rule. And we'd love to know what you think about that, if that's okay with you. And in this advance notice of proposed rulemaking, CMS mentioned that, we've made a lot of progress in expanding home and community-based services over the course of the last several decades. And that's great, that's wonderful. But sometimes what gets called home and community-based is not actually so. And so we want to start thinking about, and they articulated this again when they issued proposed rules in 2011 and in 2013, and eventually when they issued a final rule in 2014, what we want to start thinking about, CMS said, is what the bar should be for what home and community-based services should actually mean. And some of the reason for this was because there was a recognition that much of what was funded in the past, large congregate group homes, segregated day programs, sheltered workshops, simply replicated the environment of the institution. If we take you from a really big building where someone else tells you what to do at every moment of your life, and we move you to a small building where we bus you to another small building where in both of them somebody else tells you what to do for every single moment of your life, and you don't have choice and you don't have control. Mainly what's shifted has been a matter of real estate, the underlying aspects of community life. The right to decide when you wake up, the right to decide what you do during the day, the right to pick from different jobs and get support to do so have not been realized under that model. But another part of the reason why CMS did this was there was also a recognition that home and community-based services were also coming under new kinds of threats, that you now had the proliferation, particularly, and I can say this because I'm not speaking on behalf of CMS, and I come from this part of the world, particularly in certain parts of the autism world, in which there was a very heavy emphasis on creating new congregate models. CMS noted, as we've noted, that a growing number of parents, having forgotten the legacy of Willowbrook, have pushed for the creation of these oh so wonderful gated communities, villages, etc., autism villages, dude ranches for Down syndrome, etc. They call it various different things. In which people have residences and medical services and a sheltered workshop all on site. And my God, they're never going to have to leave again for as long as they live. Isn't that wonderful? And CMS recognized that as these settings started to proliferate, there was a need to articulate a higher standard of what is and what is not community. And so in January 2014, and this is one of the single most important developments in disability policy of the last 25 years, since the passage of the ADA for people with significant disabilities, this is one of the most important developments. In January of 2014, CMS, 5 years later, issued their final rule on home and community-based services settings, articulating a new standard of what is and what is not home and community-based. And in doing so, they required every state in the country to submit a 5-year plan as to what they would do to bring themselves by 2019 into compliance for all of their Medicaid-financed HCBS. Residential, day, and employment. And now throughout the country, we are seeing the beginnings of efforts under these 5-year planning processes to look at raising the bar on all kinds of different services and looking at whether or not we are truly supporting people to have autonomy and choice in a meaningful way in Medicaid-financed HCBS. There's wide variance from state to state. Some states, as have probably been consulting with many of you as experts in this process and are making concrete decisions to close the front door on sheltered workshops, to move away from sheltered workshops and other congregate models as a focus of future investment. Other states have put forward plans that essentially read as, we plan to have a plan at some point in the next several years. And that as long as we're planning to have a plan, clearly it must be good because we're planning to do it. And that's somewhat less exciting. But every state will have to meet this bar by 2019. And what we've really essentially done here through this process is we put the entirety of the Medicaid home and community-based service system on notice that what flew in the past is not what's going to fly in the present day. As you can imagine, there are some people belonging and being highly invested in the past who are not entirely thrilled by this process. I remember in 2012, the National Council on Disability, on which I serve, did a 7-state tour of different states to visit sheltered workshops, supported employment providers. I met, actually, I think some of you in the audience during that process. And what we heard out there was that in many ways, the fight over deinstitutionalization was now repeating itself in the fight to close sheltered workshops and the fight to move towards more integrated models. I remember I was shocked to hear this terminology because, it was last in vogue before I was born. I remember talking to an employment provider in Ohio, a sheltered workshop provider, who told me, this is all that normalization stuff again, that Wolfensberger nonsense. Why are you starting with that again now? I thought we passed over that already for the people we serve. So really, it's the same fight as we've had in previous decades. But in the same way, we're seeing a recognition on the part of certain states and certain leaders within states that better models do exist. I'll always remember what one of the leaders in Vermont, the first state in the country to really do it, to close all of their sheltered workshops. They did that in 2003, and today they have a rate of integrated employment that's much higher, almost twice the national average. Always remember what he said. We decided to fund what we believed in and not fund what we didn't believe in. That is an incredibly powerful statement. And with the new CMS settings rule, and with a growing interest on the part of the Justice Department to take the same legal theory, the Supreme Court's Olmstead decision, and the ADA's integration mandate that's been used to get people with disabilities out of institutions and into the community, to get people with disabilities out of other segregated settings, including sheltered workshops, with the Justice Department bringing Olmstead litigation around employment for the first time over the course of the last several years, with a growing emphasis at every level of federal policy to move towards an integrated employment model. We have the opportunity to communicate to state government in a very clear way what we believe in and what we do not believe in. Now, the other side is doing this. Now, I can assure you, and many of you have seen this in your own states, the sheltered workshop industry is powerful. They are cohesive. They are moving as one in unison. That is not going to be the case for every sheltered workshop provider. You've got some that want to do the right thing and are trying to get out of the sheltered workshop business, convert into becoming supported employment providers. I imagine some of you are here today at this conference, and to you, I applaud you. But the bulk of the sheltered workshop industry is mobilizing to terrify families with the thought that there's going to be nothing for their child. We know that for the last several decades, sheltered workshops have been utilized not primarily as a means of employment services, because if you are working for 3 or 30 or 50 cents an hour, you are not in any meaningful sense employed, but as almost a backdoor form of day activity and respite. And the sheltered workshop industry isn't telling families, maybe we can provide better day services or better respite services, let alone better employment services, than sitting in a segregated room that you didn't choose for hours and hours on end, making 3 cents an hour. No, they're saying your kids are going to have nothing to do during the day, so write your congressman and tell them that these evil zealots from the Department of Justice and from these various disability rights organizations that don't understand our children. It's the exact same message we heard in the opposition to deinstitutionalization, are trying to take away our children's services. And now that's a problem, because as you may be familiar from your own experiences with state government, policymakers, particularly policymakers in places like Medicaid, which don't even know they're in the employment business, by and large, have a lot on their plate. And so the squeaky wheel frequently does get the grease. If they consistently hear from the sheltered workshop industry and sheltered workshop parents again and again and again that the story of employment services in the 21st century are some evil, ideologically driven people trying to take it all away from people with disabilities, instead of this effort towards greater inclusion, greater integration, greater opportunity that you have all been a part of over the course of your entire careers, we are going to miss what is one of the most tremendous chances for true community inclusion that we have ever had. If we do not see a true investment, not only in getting the word out about our own services, not only in communicating to the self-advocates and families that you serve as to the promise of this new rule and the importance of writing to your state governments and to CMS and to your members of Congress saying, we want more people to have access to what we have. If we don't see, even beyond that, an emphasis on reaching the families that have been terrified, on saying there is life outside of the group home and the sheltered workshop. And in many ways, it is a better life, and it is a life with more choice and more control. If we do not find a way to communicate that to families, we are going to be lost. We know that when you're clinging to a lifeboat, it's hard to let go, even for a ship. And for too many people with disabilities and their families, our service system has had that life preserver approach for many, many decades. And so now it's time to talk about what quality can truly mean and how we can incentivize better outcomes for people with disabilities. I want to highlight one more development, just very briefly, before I wrap up here, that's coming at the federal level that you can play a really important role in. Last week, we saw a bill introduced in Congress that, for the first time, promised to put the power of the purse, to promise to really invest Medicaid dollars in outcomes, in employment outcomes for people with disabilities. Senator Casey, Senator Wyden, and Senator Grassley introduced the Transition to Independence Act. I believe it's S1604, and I'm sure if it's not S1604, someone will shout that out from the audience, but I believe it's S1604, the Transition to Independence Act. And what that legislation would do, if we have the ability to enact it into law, is it would say to state governments, if you meet specific targets for increasing integrated competitive employment, real integrated competitive employment, not workshops, not mobile work crews, not enclaves, but true integrated competitive employment, by 10, 20, or 30% in a given year over the course of this demonstration program, we are going to give you a bonus payment from the federal government. We are going to give you additional federal Medicaid funds to reflect that achievement. And similarly, if you meet corresponding decreases in the number of people with disabilities in sheltered workshops and day centers, segregated day centers, and if those people move into integrated employment or truly integrated day services, you can get bonus payments for that too. Now, those of you who have worked closely with state government know that in most parts of the country, free federal money is something that they follow, with all of the enthusiasm and, kind of an aggressive instinct of a dog with a fresh hunk of sirloin steak. And so we've got a real opportunity here to put that fresh hunk of sirloin steak in support of integrated employment. But again, the opposition is also going to be using their voices here. And so I really encourage you to use this conference and this opportunity you have to recommit yourself, not only on a personal basis, but to recommit your agencies to be instruments of advocacy in support of your friends here in Washington, in support of the work that Allison and the other folks at APSE and the wide variety of leaders at the federal level and at the state level are doing, to leverage opportunities like this new CMS settings rule, to leverage opportunities like this proposed Transition to Independence Act, to be at the table and to mobilize your self-advocates and your families who know what quality can look like when we're not just clinging to crumbs, when we are crawling out of that hole that we were placed in 100 years previously. We need to build a real movement for outcomes, for quality, and true inclusion and community living in this country. I look forward to partnering with you in that process. I look forward to you all continuing the essential work that you are doing to advance supported employment in this country. And I thank you very much for your time.